Well, good afternoon, and again, thank you all for being here today, and also for those of you that are home watching and listening. I want to start by thanking Virginians for their understanding of the need for closures and restrictions that began last night at midnight. Our team has fielded literally hundreds of emails with questions. We will continue working to make sure that everyone understands the restrictions placed on businesses under Executive Order 53, as well as the ongoing need for those restrictions. Since yesterday, we have seen an increase in COVID cases as well as additional deaths. Virginia State epidemiologist Dr. Lillian Peek will talk about that more in a few moments. But it emphasizes how we are just at the beginning of this. We are not at the middle. As I have said, we're not talking about weeks, unfortunately. We are talking about months. And we are going to see these numbers, unfortunately, continue to rise. We will continue to work on measures to contain the spread of this virus, and we are focusing our efforts on making sure that our medical system is prepared. As a doctor, I thought it might be interesting and good to offer just a quick perspective on the capacity of our healthcare system, and we will continue to emphasize the containment of this virus. But when we talk about capacity, it includes our staff, our equipment, and our bed space. I have gone through mass casualty exercises while serving as a doctor in the United States Army, and I've also been an attending pediatric physician during particularly busy cold and flu seasons at our children's hospital. For those of you that may not be familiar with an ICU setting, an ICU patient during a normal time would be cared for by a number of staff providers, which includes nurses, an attending physician, 3 to 5 consulting physicians. In the case of COVID-19, a cardiologist, a pulmonologist, and an infectious disease specialist, a respiratory therapist, a pharmacist who's part of the team, an IV technician who takes care of vascular access, and then a radiology technician who would come into the room and take x-rays of the patient. So you can easily see that you could have up to 10 or even more healthcare providers taking care of each individual patient. Now, these are highly trained individuals. They are finite in number, so we need to do everything that we can to protect them and keep them healthy. We also need an all-hands-on-deck for our staff of our medical facilities. We are exploring ways to make it easier for qualified medical professionals to help out. This includes reworking our licensing procedures and considering use of medical students and others. We also will be making better use of our Virginia Medical Reserve Corps. The VMCR is a force of dedicated volunteers who stand ready to support the community in the event of a public health emergency such as this. We have more than 8,000 deployable volunteers, and more than 1,500 volunteered just in the past month. Training is done online. We are looking for healthcare professionals, 18 or older, both current or previously licensed, as well as students. So I'd ask you, those that are able to volunteer and that are interested in volunteering, to please go to the website. It's VAMRC.org. I'll repeat that, VAMRC.org, if you are able and willing to help. To put our equipment needs in perspective, in normal times, each one of the providers I listed, each one of those 10 providers uses a new mask, a new gown, and gloves each time they go into a room to see a patient. 10 care providers, as I previously outlined, providing 24-hour care gets you to about 240 items of PPE in a day per patient. Now, if you multiply that by a hospital that, let's say, has 40 ICU patients, you're at 10,000 PPE items in a day per hospital in our Commonwealth. And then in addition to our hospital staff, we also have law enforcement, we have first responders, and we have firefighters, all of whom require and need PPE. So that is why the need for equipment for PPE is just so great. It is literally in the millions. I have encouraged our medical providers to postpone elective surgeries. Today, I will sign an executive order directing them to do so. This will preserve bed space and also equipment, including ventilators and PPE. As I said yesterday, we have put in our second request for PPE to the national stockpile. We are working with companies to donate PPE that they have available, and we are working to source more from private vendors. The cooperation that I have seen across the Commonwealth has just literally been tremendous. And to all of you that have stepped up to the plate and pitched in, I say thank you. I will add, because states are literally competing for supplies, the prices that we are seeing from some private vendors has jumped. That is why we need a nationally led response. Allowing the free market to determine availability and pricing is not the way we should be dealing with this national crisis at this time. I also want to provide an update on health facilities, that capacity of bed space. This week, my team and I spoke with the United States Army Corps of Engineers. The Corps can build emergency hospital bed capacity in sites that we identify for them. We are working to assess several potential locations in regions across Virginia should the need arise. The Corps operates by region, and Virginia is in the same region with the eastern states to our north. That means the same folks building out capacity in New York will be helping us in Virginia as well. When we have chosen sites, we will announce them. In other updates, we have made the decision to make our state parks day use only, meaning that we will close campgrounds, cabins, and bathhouses starting Friday morning. This is in line with what other states are doing, as well as some national parks. We are also moving quickly to get additional federal dollars to families that qualify for SNAP benefits for food. The Families First Coronavirus Response Act that Congress recently passed increases SNAP benefits for the next 2 months for households to purchase food. Those increased benefits will take effect tonight. I hope that when families can get more food in one trip, they will be able to make fewer trips to the grocery store. Now I'd like Virginia State epidemiologist Dr. Lillian Peek to provide us an update on our numbers across the Commonwealth. Dr. Peek, thank you.
Good afternoon, everyone. Yesterday, 101 new cases were reported to the Virginia Department of Health, and that makes a total of 391 Virginians who've been diagnosed with COVID-19. Yesterday afternoon, I'm also sad to share that 2 deaths were reported, and these were both residents of the Canterbury Rehabilitation and Healthcare Center in Henrico County. And this morning, we heard about 3 additional deaths. 2 are adults in the Peninsula Health District, and 1 is an adult in the Pennsylvania Danville Health District. Thank you. Sorry.
Thank you, Dr. Peek. Last night, the U.S. Senate reached agreement on a relief package. We're still working through the details, but I'd like to ask our Secretary of Finance, Aubrey Lane, to give you an update on what this may mean for us in Virginia. Secretary Lane, thank you.
Thank you, Governor, and good afternoon. Let me first start by thanking our federal and congressional leaders for reaching a deal on this much-needed $2 trillion stimulus package. And I would encourage them to pass this legislation promptly in order to get the money flowing. Now, this fiscal action, along with the extraordinary monetary measures taken by the Federal Reserve, offer assurances to individuals and businesses in the Commonwealth and across our country that they will be able to cope with the negative economic impact from this virus. Now, we still have not seen all the details. In fact, I was trying to read up on the roughly 1,000 pages that were sent to us, but I'm very encouraged by the comprehensive nature of this stimulus. So I'm going to go through a few of the broad categories, and this is not intended to be all-inclusive. From the very start, the governor and I have advocated for direct payments to individuals. And I'm pleased to say that there's $250 billion in direct payments to individuals, $1,200 individually, up to $2,400 for a married couple for those who qualify, and that's based on income levels. There's an additional $250 billion in enhanced unemployment benefits. This allows the state to offer what it would normally do, unemployment benefits plus $600 per week per individual for up to 4 months. And this will also include what's called gig employees or those independent conditions. There's $500 billion for loans to large businesses, those that have been impacted significantly, those industries that have been impacted by the virus. And the key to that is there's key oversight provisions to make sure that those monies are used for keeping people employed. Most directly to the state of Virginia, there's $150 billion in state and local government aid, and there's a provision in there that says at a minimum, even a small state would receive $1.5 billion, and hopefully Virginia will get much more than that as we go through and see how it is divided up. And that will certainly help us mitigate the reduction in revenues that we're expecting because of the slowdown and, in some cases, stoppage of business in our Commonwealth. Now, there's also a host of other resources in there that deal with transportation, agriculture, our food supply, housing, student loan relief, among many other things. And as we get those details and it's passed, we'll be sure to make sure that we're utilizing them efficiently for the citizens here in the Commonwealth. Now, Governor Northam has stated repeatedly that this is not only a health crisis, but it's also an economic crisis. But the way to fix our economy is to deal with this health crisis. And this stimulus package affords us the ability to do so. So I would encourage all our citizens to heed the advice of the medical authorities and base their decisions on their public health based on facts and advice from their medical resources and authorities, not some arbitrary deadlines, because we want to make sure that these resources that are put out there to help us weather this storm are used wisely. And the way to do that is for everybody to heed the advice of the medical authorities. Thank you.
Appreciate Secretary Lane. I have heard the press reports that Liberty University is inviting and welcoming students back to their campus in Lynchburg. We have heard too many mixed messages around the country about COVID-19, and this is yet another example. Our message has been clear, and it will continue to be clear. Stay home unless you have to leave for essential reasons. We appreciate our colleges and universities making accommodation for students with special cases, but that is very different from inviting students to leave their homes and come back to campus. As we are told in 1 Corinthians, it is required that those who have been given a trust must prove faithful. Proving faithful means providing clear and consistent guidance. And it means respecting the duty that Liberty University has to its students, its staff, the Lynchburg community in which it is located, and our Commonwealth. I would suggest that President Falwell look to the actions of the leaders of Virginia's flagship universities for how to set a strong example in this health crisis, and to please reconsider his message that invites and encourages students to return to campus. Thank you. I'll be glad to take questions.
Yeah, you mentioned directing I believe it was the Norfolk District Army Corps of Engineer to evaluate existing facilities as temporary hospital sites.
Yes.
When exactly was that request made, and why the need to expand the capacity of hospital sites in Virginia?
It's a great question. The question is, when was the decision made to look at alternative sites and when that will be necessary? To date, it has not been necessary, but preparation is everything here. And if one looks at the curves of the hospitalizations that we're seeing, of the increased cases that we're seeing, not only here in Virginia, but in other areas of the country, we anticipate overburdening the capacity of our current healthcare system. And so we see that coming. We want to prepare for that. And so with the help of our Secretary of Veterans Affairs, Carlos Hopkins, we have been in touch and communication with the Corps of Engineers, and we are actively looking at sites in different regions around Virginia so that we can increase the capacity for bed space if we need to. And I would also say that when we increase capacity for bed space, we also need increased capacity for equipment, which I outlined, and also for staff. And so we're working on all of that together.
Governor, can you talk about the spike in cases? Is that because of increased testing? And if so, can you talk about how testing has increased and public versus private lab testing?
Yes, Greg, the question was we're seeing a spike in the number of cases, and why is that? It's really twofold. It's one that we're able to do more testing. That's clear, and we've seen that across the country. And it's also clear, Greg, we've got community spread now. That is quite obvious. And so because of those two reasons, the numbers are increasing. I will ask Dr. Peak, actually, to comment on the availability of testing as we are today.
So as the governor said, we are seeing an increase because of both increased testing and increased cases. And at this point, more of the cases that are getting reported to us are from private labs than the state lab.
And do they have a different pace of testing than the public labs do?
So your question is, do the private labs have a different pace of testing than the state lab does? And do you mean the turnaround time to receive the test? Yes, it typically, for most of the private labs, it is taking them longer to provide the test results back to the provider.
Dr. Carey, please.
Just to add on what Dr. Peak has said, the commercial labs, LabCorp and Quest, are generally in the 4 to 6 day turnaround time. But in addition to the state lab, we also have the rise and capability and capacity in health system and university laboratories. So UVA as well as VCU and other health systems are developing their own labs, and they're, UVA has been online for a number of days, so their turnaround times are similar to we have at the state lab in the 8 to 12 and certainly 24-hour range. So the benefit of testing will be both capacity, but also the type of testing. As you can imagine, if there's someone with a clinical syndrome like COVID-19, the governor's outlined just how intensive the use of PPE can be. But if we're able to rule out COVID-19 and influenza, then often the intensive protection equipment can be downgraded to another level. So being specific about whether a patient has or does not have COVID-19 in a rapid period of time is an important tool.
Yeah, the governor of New York today estimated the peak for their state would be April 15th. Do we have an idea of what Virginia's peak looks like? And then also I wanted to circle back on tolls.
Yes.
But one at a time.
Great. So first, Dr. Peak, I will ask you to address the peak of this, if you can.
We don't have data at this time to estimate what that peak might be, but we have heard from different entities who are working on modeling, and we are working with them and hope to have more information soon.
Secretary Valentine will address your transportation questions. Thank you, Shane.
Of course. Would you mind sharing your question?
Yeah, so we were wondering, we got a lot of emails about people wondering why cash tolls are still in effect, and if there's been any decision about those being closed to prevent the exchange of cash as well as to protect those workers.
Yes. A very good question. We're also getting those as well. In Virginia, we have 16 toll facilities. Of those 16, Virginia owns and operates 4 of them. So we're working with the public and the private sector. Of the 16, 8 are completely electronic with Easy Pass or the image pay by license plate. We are now working with the remaining 8, and of those 8 remaining, 2 are VDOT owned, so we're moving those to all electronic. The others, we are continuing to try to move them in that particular direction. There are 3 in particular that we're going to have to be a little bit more creative with. However, all 16 except Easy Pass. Easy Pass is free. You can go to easypassva.com. You can order one for free. We will deliver it to you. And on the VDOT website under Easy Pass, there are retail establishments and grocery stores that you can actually go and pick one up. We also are working on an application, an app on your phone called GoToll.com, which you can also use your phone, which can be accessed within a very short time. We are urging all the facilities that aren't completely electronic to have credit card machines available. We are urging citizens to have exact change, which also helps. But for those cases where, like with the Chesapeake Bay Bridge Tunnel, where there's a gate, there's a person, we are ensuring at all 16 that everyone has gloves, that the workspace is being cleaned and sanitized, that the money is being separated between shifts. There's hand sanitizer, and it's very much, like a pickup or delivery at a restaurant. We're trying to make that transaction as clean as possible. We are requiring it within our VDOT-owned toll facilities. We have received confirmation through David Caudell, the administrator of our toll facilities in Virginia, in working with all operators, private and public, that is indeed the case. So it's an ongoing process. We certainly want people to be able to move those who are essential, and for those who are providing critical supplies, that we have our roadways open. So thank you very much.
The Canterbury Healthcare and Rehab Center, where they had the 2 deaths from yesterday. What additional steps, if any, are being taken at some of those at-risk facilities? As we've learned, Canterbury now has 13 and potentially even over a dozen additional cases there. We saw how that played out in Seattle and Washington at times.
Thank you.
So first of all, the question is, what additional steps are being taken with long-term care facilities and other high-risk medical facilities so that they are taking precautions to prevent the spread of the virus in their facilities? And so first of all, we're providing a lot of education and guidance in advance. We have that information on our website, as well as we've provided a webinar and have sent out literature. When we identify a case in one of these facilities, our epidemiologists and healthcare infection prevention team works with that facility to understand how they're operating, what different strategies we can put into place to improve their infection control, and then we continue to work with them to monitor what's going on. And that's what we've done in that case.
On the Canterbury rehab situation, do we know how the outbreak there, became so extensive, and are we seeing similar outbreaks at other facilities across the state?
So we are still investigating to understand what happened there, and we are seeing other cases in long-term care facilities and in other congregate settings, medical settings, but we haven't seen any with that amount of spread.
And do we know how it spread? We don't know how it spread so widely across that particular facility.
So the question is, how would it spread so widely? And so that, it does spread person to person. And so there were, people came into contact with someone who was ill, and that's how it was spreading.
Have you taken any further steps to provide child care for healthcare workers? You spoke about that earlier in the week and said guidance was coming.
Yes, is Secretary Lane here?
Thank you, Governor. Commissioner Duke Storin of the Virginia Department of Social Services, that team, along with the Department of Education, have put out guidelines on their website. So I think that's where we're focused, and we continue to make sure that essential workers in all areas, and especially our healthcare workers, are getting the child care needs met, their child care needs met. So we're looking at that in those venues on a daily, if certainly weekly, but really daily basis.
Governor Northam, any thought to following Florida's steps in issuing an executive order mandating mandatory quarantine for those traveling from the high infectious areas such as New York?
It's a great question, and the question is, what about those individuals that have been in New York and are traveling to other areas of the country, in this case, Virginia, and we are following the guidelines. If someone has been in New York where there seems to be a higher incidence of COVID-19, we would ask them to quarantine for 14 days if they come to the Commonwealth of Virginia.
Yeah, so we also have a lot of emails about rent and eviction freezes, given that it's the end of the month. Have you given any thought, and do you have the authority to actually mandate that people don't have that burden?
Yes, Secretary Lane, do you have any thoughts on that?
Yeah, if I may, part of this, I should have mentioned, part of the stimulus package was for housing, and in that regard. Of course, in last year's the governor's budget, there was additional monies set aside for helping with attorneys and evictions. But I don't think any action has been taken, or the governor has the authority, I don't believe, to basically stave off a private action in that. But of course, been encouraging all the localities and working with the housing authorities and the local governments with the private sector, much like we do in other areas, to be cognizant of what's going on here in the Commonwealth with the virus.
I'm sorry, the administration does not have the authority to mandate rent and eviction freezes?
I do not believe that he has the authority. But I'm happy to check on that, but I don't believe he has that authority.
One thing, do you have the authority to actually force Liberty to close?
To force, I'm sorry, your question?
Liberty to close?
No, I don't. We just are asking them to follow the guidelines that other colleges and universities are following. I appreciate you all being here today. I encourage all Virginians to continue to take this seriously, as we have said each day, to prevent the spread of this, to protect our capacity in our healthcare facilities, to protect our healthcare providers, our first responders, our law enforcement, et cetera. Please continue to follow the social distancing. Try to keep your space to 6 feet, and frequent hand washing, and try to keep your hands away from your face. And again, if at all possible, stay home, especially if you aren't feeling well. So thank you all again for listening, for being part of the solution. We are available around the clock. Unless something changes between now and Friday, we will be back with you on Friday at 2 p.m. So thank you all so much.